And it really begs the question, if you and I and medicine in general should start thinking about how we counsel people around, stopping these medications, particularly if they're at cardiovascular risk.
Yes. So this is not coming off of a cardioprotective medication, a medication that provides significant metabolic benefits. This is not not a cosmetic issue. This has nothing to do with how well your clothes fit. These are medicines that, in many cases and in many different trials, have been shown to significantly reduce the risk of major adverse cardiovascular events in, for example, people with type 2 diabetes at high risk for such events, and people with overweight or obesity who have established cardiovascular disease. So these are drugs that have shown a benefit, and we don't think that that benefit is only because they help people lose weight. It's probably far more complex and effective. So we know that when you take the medicine, it helps to reduce the risk of these serious adverse outcomes. And when you stop the medication, again, we know that people on average tend to regain weight. Their control of their cardiometabolic risk factors tends to deteriorate. And we would assume that along with that, the cardioprotective benefit of having been on those medications will dissipate. And there are data to support that now.
No, I agree with you completely. As a heart surgeon, and for those listening, if you've got a heart condition or you live with high blood pressure or you live with high cholesterol, and I think this is something that you and I have spoken about in the past as well. If you're taking a medication for high cholesterol to reduce your cardiovascular risk, you take it long term.